Auricle. So in the core features, we have the first feature, that is live classes. So live classes basically are those where knowledge meet interaction, means there will be live interaction of the student with the faculty. Then also we provide recording sessions in which the student can have access to all the subjects anytime, anywhere through recorded sessions. Then we also provide notes that are basically ultimate comprehensive books with CBME based question answers, MCQs, and full zone for self-assessment. And also MCQs are there from beginner level to the expert level. Then you can also book a slot for personalized counseling session in which there will be a one-to-one session of the student with the counselor. Then we also provide some subscriptions plans. So we have three plans basically. The first basic, standard, and the premium. So the first basic plan is of 3 months that cost around 15,000. It includes pre-recorded classes, live classes, quick revision examination module. Then in standard plan, it is of 6 months and cost around 30,000. So it's include pre-recorded classes, live class, live doubt clarification, quick revision, examination module. Then the premium plan is of 12 months that includes, that's cost around 50,000. It includes pre-recorded classes, live class, live doubt clarification, one-to-one personalized guidance, notes, quick revision examination module. So basically the premium plans includes all the facilities, all the features of the Auricle. So I would recommend all the students to take the premium plan. And also for 20% instant discount, you can use my code Aanchal20, AANCHAL 20. Then, as we have discussed that the series of the GIT is going to complete, and today on 6th March, we are having the last class of the GIT, that is over the large intestine. So, now talking about the introduction part, in which we're going to discuss the basic morphology, basic location, and the function. So, the function of the large intestine or large bowel is to absorb water from the remaining indigestible food matter. So as in the previous classes, we already have discussed that the full digestion of the food occurs inside the small intestine. So now here in large intestine, the waste product comes, and from the waste product, there will be absorption of water so that the formation of feces can be occurred. So basically in large intestine, there will be absorption of water and the formation of feces will occur, right? So there will be absorption of water from the remaining indigestible food matter and then to pass the useless waste material from the body, means the useless waste material get rid out of the body, right? Now talking about the parts of the large intestine. So the main part of the large intestine, the first we have cecum and the second we have colon. Okay, so basically the part which is connected to the small intestine to large intestine is cecum. Okay, and in between small intestine and large intestine, there is a presence of wall that is known as ileocecal wall. Right. So basically, it starts in the right iliac region of the pelvis, just at or below the right waist, where it is joined to the bottom end of the small intestine with cecum. So the first part of the large intestine we have cecum, and from here it's continuous the abdomen, transverse colon, and then across the width of the abdominal cavity we have the first we'll have ascending colon, then we have transverse colon, and then it turns down with descending colon, and in the end we have sigmoid column which joins to rectum and to anus, right? The large intestine is length around 1.5 meter long and 4.9 feet long, about 1/5 of the whole length of the intestinal canal. And why this is known as large intestine? Because of its large diameter. Okay, so the diameter of the large intestine is greater than the small intestine. That's why it is known as large intestine. But if we look at the length of the large intestine, so it is less than the small intestine, right? So here we have discussed the some functions and about the parts of the large intestine. So as we have discussed that large intestine or colon extends from ileocecal wall, right? The wall which is present between small intestine and large intestine up to anus. Now, following parts are there like cecum with appendix, ascending colon, transverse colon, descending colon, sigmoid colon or pelvic colon. Then we have rectum, then we have anal canal. Now, as we look for the parts of the large intestine, so as we can see that there is a presence of cecum, and with cecum, there is a presence of cecum, and with cecum, there is a presence of ascending colon. Then we have this transverse colon, then descending colon, the sigmoid colon is present, and then last we have rectum. And rectum is the structure where there is storage of feces occurs. Okay. Now talking about the structure wall of large intestine, right? So the wall of large intestine is formed by 4 layers of structure, in which the outer one is known as the serous layer, and again it is formed of peritoneum. Okay, so the most outer wall is formed of peritoneum. Then we have the muscular layer. Okay, so the smooth muscles of large intestine is distributed in 2 layers. The first we have the outer longitudinal layer, and the second we have inner circular layer. Okay, so basically the smooth muscles are present because of involuntary actions, and 2 layers are present. The first we have the outer longitudinal, and the second we have inner circular layer. And the longitudinal muscle fiber, right, of large intestine are arranged in the form of 3 bands that is known as tinea coli. And the length of the tinea coli is less as we compare to the length of the large intestine. And because of the presence of this tinea coli, the large intestine is made up of pouches, and that is known as haustra. Right? Okay. Then the submucous layer is basically not as much developed in large intestine. Then the last we have the mucus layer. Okay. So in mucus layer, there is the presence of crypts of Libercun are present in mucosa of large intestine, and the villi. The villi are present in basically in small intestine, and they are absent in large intestine. Only mucus secreting glands are present in the mucosa of the large intestine. And what is the significance of these mucus secreting glands? So that they can secrete the mucus, so that the lubrication and motility of the food or the waste material can be facilitated inside the large intestine, right? Now, let's talk about some main function of the large intestine. So if we look at the functions, so first we have the very important one, that is absorptive function, right? So in absorptive function, large intestine play a very important role in the absorption of various substances, in which it includes first the water. So mainly the water absorption occur inside the large intestine, then absorption of electrolytes, then organic substances like glucose, then some alcohol, some drugs are also absorbed. Okay, so the first function and the very important function is absorptive function. Okay, so mainly the water get absorbed inside the large intestine. And what is the significance of this absorption? So basically, whenever huge amount of food that comes from the small intestine, so basically that food is that food is basically that is not get absorbed by the small intestine, means it is not required by the body. So basically this food is basically that one that should get eliminated out of the body. Okay, so here as the absorption of water occurs, simultaneously there will be formation of feces that occurs inside the large intestine, right? So, after the absorption of nutrients, water, and other substances also, the unwanted substances inside the large intestine is formed in the feces, like in the form of feces, and that should be excreted out of the body whenever the defecation reflex will come. Okay, so the first function we have discussed, the absorptive function. The second we have formation of feces, and the third we have excretory function. So as there will be formation of feces, so obviously that feces get also eliminate out of the body, and along with the feces there will be eliminations of some substances also, like some heavy metals like mercury, lead, bismuth. Okay, then fourth function we have excretory function. Okay, so in excretory function already we have discussed. The fourth function we have secretory function. So large intestine secretes mucin in substances like chlorides and bicarbonates also. So these substances also help in the motility of the food, right? Then last function we have the synthetic function. Another function also we have synthetic function. Okay, so what is this synthetic function? So basically, in synthetic function, we study that the bacteria flora that is present inside the large intestine synthesize some substances like folic acid, vitamin B12, vitamin K. Okay, and by this function the large intestine also contribute the erythropoietic activity. As we know that both folic acids and vitamin B12 both are responsible for the maturation of RBC, right? So basically in this way the large intestine also contribute to erythropoietic activity, right? And this vitamin K helps in blood clotting mechanism. Clear? So this is the synthetic function that is performed by the large intestine. So I hope all the functions of large intestine is very well clear to all the students. So first we have, again I'm discussing, first we have absorptive function, in which there will be absorption of substances like water, electrolytes, organic substances, alcohol, some drugs also. Then there will be formation of feces. So after the absorption, the unwanted substances in the large intestine form feces, and then this is excreted out of the body. Then in excretory function, we studied that large intestine also excretes some heavy metals like mercury, lead, bismuth, and arsenic through the feces. Then in secretory function, we studied that large intestine also secretes some substances like mucin, inorganic substances like chlorides and bicarbonates. And in synthetic function, we study that inside the large intestine, with the help of the bacteria flora, there will be synthesis of the folic acids, vitamin B12 and vitamin K, and both vitamin B12 and folic acids are responsible for providing the erythropoietic activity, whereas vitamin K is responsible for the blood clotting mechanism. Next, we have the secretion of large intestine juice. Okay, so first of all, the large intestine juice is a watery fluid because the maximum content is water. It is approximately 99.5% and around 8. Okay, so in large intestine juice, we have solids and water. So water, as we have discussed, it is approximately 99.5%. And in solids, we have inorganic and both organic substances. So in organic substances, we have albumin, globulin, mucin, urea, debris of epithelial cells. And in inorganic substances, we have sodium, calcium, potassium, bicarbonate, chloride, phosphate, and sulfate. Okay, so this is all about the composition of large intestine juice. Now, we should look that what is the main significance, means what are the main function of this large intestinal juice. Okay, so in function, we study mainly for the two main functions. The first is the neutralization of acid and the second is the lubrication activity. Okay, so as we have seen that there is a presence of some bacteria inside the large intestine also. So because of these bacteria, there will be formation of some strong acids inside the large intestine, right? So because of these bacteria, there will be formation of some strong acids. Now some ions and some things are required to neutralize that acid also. So because as we have seen, the nature of this large intestinal juice is alkaline because its pH is 8, right? So the strong acids formed by bacterial action in large intestine are neutralized by alkaline nature of large intestinal juice. So because of the presence of a large intestinal juice, this acid that is formed by the bacteria will get neutralized inside the large intestine, right? So first function is clear to all the students. Then second, we have the lubrication activity. So obviously by lubrication, we can find out that lubrication means some substances are present which will be responsible for facilitating the movement of the feces or the waste product or the undigested products, right? So mucin is present. Okay, so that substance is mucin. So as we can see in the composition also, in large intestine juice, in organic substances, we have mucin. Okay, so mucin present in the secretion of large intestine indicates the mucosa of large intestine and the bowel content, so that the movement of bowel is facilitated. So because of this mucin, because of presence of this mucin in the large intestinal juice, the bowel movement will be facilitated, will be proceeded in the anterograde direction, means in the forward direction inside the large intestine, right? And also it protects the mucous membrane of large intestine by preventing the damage caused by mechanical injury or chemical substances. So basically, this large intestine juice, the organic contents present in this large intestine juice is also responsible for preventing the damage to the lining or to the mucosa of the large intestine. So as we can see, this large intestine juice is very, very important and it play a very important functions inside the large intestine, right? Okay, now let's talk about some movements that occurs inside the large intestine. Okay, so in last class also, in small intestine also, we talk about two movements. The first was segmentation and the second was peristalsis, right? So in segmentation, we have learned the segmentation was the movement that is responsible for mixing of food with the juices that is present inside the small intestine, right? And the peristalsis was that movement in which there will be the formation, there will be the motility of the food, means the food will move in the anterograde direction. So same type of movement present in large intestine also, but the name will change. So in large intestine, we have two movements. The first we have mixing movement and second we have propulsive movement, right? So, in large intestine, the mixing movement is known as hostration. Okay, so means if this is large intestine, so again, the food will move to and fro. Okay, so that there will be mixing of the food with the juices. Okay, and in large intestine, this movement is known as hostration, and the propulsive movements means in this movement, there will be forward motion of the food, means there will be forward motility of the food in the anterograde direction. Okay, So the name of the propulsive movement is mass peristalsis. Okay, now we're going to learn both the movements in detail. Okay, so in ostration, the length of the portion of colon involved in each contraction is nearly about 2.5 centimeter. Then the type of colonic movement, as we are discussing, so basically the haustral contraction once initiated usually reach the peak intensity in 30 seconds. Means once it is started, once it is initiated, it will reach the maximum peak in 30 seconds and then disappear during the next 60 seconds, right? Then they also at times more slowly and involves during their period of contraction, especially in the cecum and ascending colon, right? And after another few minutes, new haustral contraction occurs in other area nearby. So means once they will start the peak, they will reach in 30 seconds and suddenly they get disappear, and again with another few minutes they will again start it, but that time the area will be different, right? So in this way, all the fecal material is gradually exposed to the surface of the large intestine juice and fluid, and it's progressively absorbed until only 80 to 150 ml of 1500 ml daily load of chyme is lost in feces, right? So I hope all the students is clear about this movement. So again, the brief summary is there. So they help in making of contents of colon and it goes to molar to facilitate absorption. They occurs less frequently and maybe after 30 minutes. They are like segmentation, as we have talked. The segmentation movement occurs inside the small intestine, right? Now the haustral movement are largely controlled by the locally mediated reflexes that involve the intrinsic plexus. Okay, so means this movement is controlled by the intrinsic plexus, right? Now the motility in large intestine. So as we have talked about the peristalsis, right? So peristaltic wave is the wave which function to propel the content towards the large part of the GI tract. So basically towards the rectum, and rectum is the part where the storage of food, the storage of feces occur basically. Then the mass movement is the strong peristaltic movement or strong peristaltic waves. So they move the material from one portion of the intestine to the another portion. So basically these movements generate to sweeping the food in the forward direction, right? And in means how many times they will occur. So basically they will occur 3 to 4 times per day and usually generated after meals. An increase in motility moves the feces towards in few seconds. And this is the reason that in newborns, the defecation reflex immediately arise whenever they had food, any kind of food, they have milk or anything. So this mass movement is responsible for that reflex. Okay, so basically this strong peristaltic waves generated 3 to 4 times per day. Okay, so if they will generate 3 to 4 times, it means they will initiate defecation reflex 3 to 4 times per day, and generally after the meals, right? An increase in motility moves the feces towards the end part in few seconds, right? When material reaches the rectum, the rectal distension initiates the defecation reflex, right? Now we're going to learn about the defecation reflex, that basically how the defecation reflex control, right? Now a very important thing comes here, that propulsive movement, as we have discussed the mass peristalsis. So as we know that this propels the feces from colon towards the end part, means towards the anus, and occurs only a few times, 3 to 4 times every day. And this is because of the neurogenic factor, that is gastrocolic reflex. Okay, so this reflex, gastrocolic, means from stomach to colon. Okay, this is gastrocolic reflex, and because of parasympathetic stimulation. Okay, so both the things are responsible here for the mass peristalsis. Now we're going to learn about the defecation reflex. Okay, so feces are eliminated by defecation reflex. And what is the stimulus? So when mass movement of colon move the food or move the feces into the rectum, there will be distension of rectum initiates the reflex. So basically, there are presence of some receptors inside the rectum, and whenever there will be distension of rectum occur, there will be activation of those receptors, right? So there are presence of some receptors in the wall of the rectum, and if distension of rectum will occur, these receptors get activated. Okay, now afferent impulses occurs through parasympathetic nerves, and center is the spinal cord, sacral part, that is S2, S3 and S4. Again, efferent impulses generated by parasympathetic nerve causes contraction of smooth muscles of rectum and sigmoid colon, relaxation of internal sphincter. Now, as we know that inside the rectum, there is presence of two sphincter. The first is the internal allen sphincter and the second is the external allen sphincter. Now, as we can see, this internal allen sphincter is made up of smooth muscle fiber, and this external anal sphincter is made up of its skeletal muscle fiber. So means if this is made up of smooth muscle fiber, so this is involuntary in nature, and this is made up of skeletal muscle fiber, means this is voluntary in nature. Right? Defecation reflex going to study, right? So defecation is the stretching the rectum stimulates defecation reflex. So as we know, whenever there will be accumulation or there will be storage of food inside, storage of feces inside the rectum, so there will be distension of the rectum occurs, and the stretch receptors which are present inside the rectum will get activated or get stimulated, right? So the defecation is basically the urge to defecate that is often felt soon after a meal, and intensive defecation reflex works entirely within the myenteric plexus. Okay, so myenteric plexus is the plexus which is responsible for initiating the motility of food, right? Now, parasympathetic defecation reflexes involve spinal cord, that is because of stretching of rectum sends sensory signal to spinal cord. Then pelvic nerve turn signal intensify peristalsis and relaxing the internal and anal sphincter, and defecation occurs only if external anal sphincter is get relaxed, and that is because of our own voluntary desire or voluntary, because of a voluntary control, right? So a very important and the interesting one also. So whenever this mass movement occur, okay, means this mass peristalsis occur inside the GI tract. So there will be accumulation of food inside the rectum. So rectum will get distended. And those receptors which are located in the wall of the rectum will get activated, and they will immediately send signal to the sacral spinal cord, sacral part of the spinal cord, that is S2 to S4, and give desire to defecate. Now, through pelvic nerve, through the parasympathetic nerve fiber, there will be relaxation of internal anal sphincter. Okay, always remember, through pelvic nerve, there will be relaxation of internal anal sphincter. Now, if the condition are right, means if the person are willing, there will be relaxation of the external anal sphincter also, and the process of defecation will occur. Otherwise, the reflex subsides until the rectum is filled again. So means after some hours, again, this defecation reflex will occur, right? So the composition of stool is 3/4 water and 1/4 it's undigested in unabsorbed food. Basically forms the stools. Then intestinal secretions are also there. Bile pigments and bile salts are also there. So bacteria, inorganic material also there, and epithelial cells and leukocytes also includes inside the feces. Now, another thing is dietary fibers. Okay, so we're going to learn what are the dietary fibers and what is the main importance of these fibers. So basically, dietary fibers is a type of carbohydrate. Okay, so that cannot be digested by our body's enzyme. Okay, so basically, for dietary fibers, for the digestion of dietary fibers, we require a particular enzyme that is known as cellulase, and that is not present inside the human body. So in this way, because of this, these dietary fibers cannot be digested by our own body enzyme, because the cellulase is not present inside our own body, right? So it is found in edible plants such as cereals, fruits, vegetables, dried peas, nuts, lentils, and grains, right? So fibers is grouped by its physical property and is soluble, insoluble, or resistant. Now the examples of dietary fibers: hemicellulose, cellulose, and pectin. Now, what are the advantage of these dietary fibers, right? So, various advantages are there. So, one of them is normalize the bowel movement. Okay, so patient who is taking a very rich dietary fiber diet, there will be it will basically normalize the bowel movement, right? So dietary fibers increase the weight and size of your stool and also soften it. Okay, so any person who is also suffering from the complaints of constipation, so the doctors always recommend to include the dietary fibers in their diet. Also, it helps maintain bowel health. Also, it helps in lowering the cholesterol level and also control the blood sugar level. Also, it helps in achieving the healthy weight, helps you live longer, decreases the incidence of cancer of colon, relieves constipation, reduces the incidence of obesity, diabetes, hypertension. So obviously, with good high lifestyle, the person will reduce these incidents, right? And so it slow down the process of atherosclerosis, means deposition of fat over the blood vessels, right? These are the main advantages of dietary fibers. And the question over the short note over the advantage of dietary fibers or over the dietary fibers can come. So if it will come, so student need to mention about a brief introduction of dietary fibers, and also they can include these advantages. Okay. Now the applied physiology of large intestine. So first we have a very important condition, that is diarrhea. Okay, so what is diarrhea? The diarrhea is the frequent and profuse discharge of intestinal contents in loose and fluid form, right? And it occurs due to increased movement of intestine. Okay, so means the person will defecate more than 7 to 8 times, or it can be more than that also. Okay, and the stools will also become very loose. And the diarrhea is caused by intake of contaminated water or food. The food intolerance is the condition in which acute diarrhea is caused mainly by indigestion of food substances. Okay, so the bacteria are responsible like E. coli, Salmonella, Shigella. The viruses like rotavirus, hepatitis virus, parasites are also there. Then the reaction medicines are antibiotics, anti-hypersensitive drugs, antacids, contain magnesium and laxative. So these are the medicines that is always recommended by the doctor for the person who is suffering from this condition, right? Then we have intestinal disease. So chronic diarrhea occur during the inflammation of intestine, irritable bowel syndrome is there, and abnormal motility of the intestine. Now, severe diarrhea results in loss of excess water and electrolytes due to it's basically it leads to a condition that is dehydration and electrolyte imbalances. And other features of diarrhea, we have the abdominal pain. The person will always complain of the abdominal pain, of the nausea, and the bloating. Okay, so what is bloating? The bloating is a condition in which the person always complain of the tightness of the abdominal area. Okay, so a condition in which the subject feels the abdomen full and tight due to excess accumulation of excess intestinal gases. So now the constipation is basically whenever the person will, there will be failure of voiding of feces, okay? And obviously it will produce a very discomfort to the person, and it is due to the lack of the movement that is necessary for the defecation. The feces remain in the intestine for the long period, resulting in absorption of fluid, and it become hard and dry. So basically, because the feces get accumulated inside the large intestine, and obviously we know that the function of the large intestine to absorb water. So as the feces will remain in the large intestine for the long time, so there will be more and more absorption of water from those feces, and ultimately the feces will become very hard and dry. So obviously whenever the person will defecate, so the person will suffer, will have a trouble in the defecation process also. Now, the dietary causes, because of lack of fibers or lack of liquid in diet, which causes constipation, and irregular bowel movement is also a reason. It causes constipation by inhibiting the normal defecation reflexes. Now, the spasm of sigmoid colon. So, in spasm of sigmoid colon prevents its motility and results in constipation. Now, the constipation is a many common types of disease, and the dysfunction of mesenteric plexus is also another reason. So, is megacolon is the condition that is characterized by distension and hypertrophy of colon, which is also associated with constipation, right? And congenital development of megacolon is known as Hirschsprung disease. Now the drugs. So the drugs like diuretics, pain relievers, antihypertensive, and anti-Parkinson's drug, antidepressants, and the anti-convulsants are causes constipation. Now the next condition that is known as appendicitis. So as the name suggests, appendicitis means the inflammation of appendix, okay, and it is situated on the lower side of the abdomen. So the main features of this condition that it starts around the umbilicus and spread to the lower side of the abdomen and becomes severe within 6 to 12 hours, okay. And the features are nausea, vomiting, difficulty in passing gas, lower fever, low fever, abdominal swelling, and loss of appetite. Now, next we have the ulcerative colitis, and also known as IBD. So basically, ulcerative colitis is an inflammatory bowel disease which is characterized by the inflammation of ulcerative abrasions in the wall of the large intestine. Means there will be inflammation in the large intestine. So it is also known as colitis, and the rectum and the lower part of the colon is commonly affected, right? So it affects people in the age group mainly between 15 to 30 years more commonly. So again, the features are abdominal pain, diarrhea, fatigue, loss of appetite, arthritis, osteoporosis, liver disease like hepatitis, cirrhosis, skin rashes, and anemia. So this is all about the large intestine. So I hope the student finds the class very useful. And in the last, we have some MCQ questions. So for each questions, I'm going to give 30 seconds to the student. So first question, we have the vitamin K is a necessary product for blood clotting, as we have discussed. So which of the following statement is true in reference to vitamin K? And I think all the student will be able to give the answer. 30 seconds are here to give the answer. Yes, the answer that it is produced by the bacteria that live in large intestine, right? Now, what is the main form of food propulsion through the large intestine? Means in which form there will be movement of food in the forward direction. The options are segmentation, pendular movement, march movement, peristalsis. So as we know, the segmentation movement and pendular movement both are same, and they both occur inside the small intestine. Now the options, mass movement and peristalsis. Again, you have 30 seconds to do.